Today is a day, I think, of really good news for many people. We have been talking about childcare for a while. We've talked about what we've tried to do to help childcare during these difficult times because childcare is one of the areas that we know is critical to opening the economy, is critical to parents, has been critical to our essential workers. We opened some limited duration centers, and since the beginning of March, we have put out to child care providers almost $62 million worth of payments. And the reason we do that is because we have child care deserts, we know we have places of need, and we really can't afford to lose many or any providers. And so today we're going to talk about opening, and that's always a balance between protecting ourselves, our families, and being able to go back and be healthy at work. So, on June 8th, the governor talked about we're going to open up what are essentially the small in-home providers. Those are the providers that take care of 10 children or less, primarily more in a family-style atmosphere, and we are going to ask for them and allow them to have the opportunity to open on June 8th in accordance with the guidance that I'm going to talk about in just a moment. Then our larger center-based providers, we are going to ask them to open on June 15th. And these are our larger providers. And again, we're going to provide some guidance for them in addition to their regulatory requirements. So an overview of those additional requirements. So what we're going to ask is that as groups go out to the playgrounds and play together, that we stagger those groups. We're also, of course, going to ask for temperature checks and wellness checks on entry for everyone. We're going to ask that some of the family events that have normally happened in the centers not happen for now. We're going to ask that centers eliminate the field trips that they would be going on, again, just to make sure that they are and the children are all within one center and not going from one group to another. And then, as some centers already do, but we're going to ask for a centralized pickup and drop-off for child care centers. Now, the main things that we're going to ask is that any group of children, any room that children are in, that it be 10 or less children in a group, and that those groups stay together all day, and that the staff that are working with those groups stay with those groups so that we can, again, think about it, just limit, like within a cell, of the exposure that people have and children have and staff have within childcare. The other thing that we're going to ask, of course, adults need to wear masks, and children, age appropriate, should wear masks as well. We've given guidance about children under 2, but within facilities we're going to ask that children under 5 not be required to wear masks, and that it's a judgment call on a child's developmental ability and making sure that you're making the right call on safety for that particular child. So as children are able, they should wear masks. And these guidelines will be up at 5 o'clock on the website. These and some additional guidelines. So we're asking centers to read those, let us know when we have questions. We've had a group of folks across the cabinet and working with the University of Kentucky to work on these guidelines so that they can be manageable and safe and balanced so that we can begin to reopen our economy. And I think it's really good news that we are at the point where we feel like we can open up and begin to open up childcare in a responsible manner. The next piece of good news, I have 2 pieces of good news today. The next piece of good news is called Pandemic Electronic Benefits Transfer, because, you know, we in government don't like to make anything sound easy. So what this is children who would have been receiving free and reduced meals in schools will be provided, their parents will be provided some additional benefits so that they can use that to feed their children so that their children don't go hungry because they're missing meals at school. This is a federal program. It comes through the Family First Act through Congress. It's an additional $163 million to the state of Kentucky. And so how this will work is if someone is already eligible for SNAP or TANF or Medicaid, those folks who are already eligible for those programs through the Cabinet for Health and Family Services will have this benefit added to their benefits. If you already have a SNAP card, it will just get added to your card. If you have an EBT card from the Cabinet, it will automatically get put on that card. If you don't have one of those cards, but you're in our programs, like you're in a Medicaid program, a card is going to be mailed to you. Now, some folks who get free and reduced meals or attend a school that has free and reduced meals for everyone in that school, you can also apply for this benefit. Now I have to put on my glasses. So, on the 23rd of June, you can start to apply for benefits. And those benefits are the same way you would apply through Benefind. There's benefind.ky.gov, or call this number. We've been doing great with our phones, so we've been answering in less than 10 seconds, so don't be afraid to call. And if you call, we can get these things activated for you sometime between June 1st and June 30th. This will help you buy groceries, and this will provide the food assistance that your child might be missing in schools. And so SNAP benefits, and we talk about this, and we talk about individual benefits to families and children. Also know this, like I talked about with Medicaid, when you apply for Medicaid, you are actually supporting the health system of Kentucky. When you apply for these benefits, it's not just you as the individual that benefits from that. It's your grocers, it's your local businesses, it's the entire food system in Kentucky that benefits farmers. You can use some of these benefits at the farmers market. So this is a way to help Kentucky farmers and Kentucky grocers function in Kentucky and function when we are having a time where people's incomes are reduced. And so this is a way to support your local businesses. So don't feel like this is something that is selfish or you shouldn't do or anything like that. This is a program designed to help people. This is a program designed to help people get the food they need. And as a benefit to your community, this is a program that helps your local grocer and your local farmer. So don't be shy. Please sign up for these programs. And now we will bring up